Thanks, Allison, for the introduction, and thanks for everyone for joining us this evening. We wanted to find some topics that were going to be very pertinent to our students that are listening, and we wanted to try to highlight some of the differences that you might encounter either on affiliations or as you begin to job search between private practice and maybe a hospital-based or university-based setting. And there really was no one else better to help kind of lead this conversation than our CEO, Patrick Graham, who's been with our company now. Ooh, Patrick, I'll let you introduce and give some of the vital information, but I've been fortunate to work with him for over 25 years. And can you tell us a little bit about your journey to CEO, Patrick?
Sure. Thank you. And welcome, everybody. It's an honor to be here. And thank you, Joe. Actually, I've been with HPRC for 34 years, April Fools. So I'm in my 35th year. Yeah. So I knew when I went to PT school, I wanted to be in private practice and on the business side of things. It just so happened that I fell in love with a fellow PT classmate, and her father actually owned a large rehab company. And after working apart in Chattanooga, where I grew up for a year, she was happy and I wasn't. And we were moving forward to being more serious. So her father offered me a job, and I moved down here in 1990. And we are actually the second oldest private practice in the country. My father-in-law started our company in 1955. So we're in our 69th year, which tells you a lot about what we value in the fact that we value people. And by valuing people, we've got amazing people like the ones you're going to meet tonight and Joe. And that's what's allowed us to continue on for 69 years. I actually went back after practicing for 8 years and got my MBA in family business and entrepreneurship. And from there, I worked my way up the ladder, so to speak, into administration. I saw an opportunity early on in the workers' comp world, and kind of made that my focus and developed that and grew that for the company. And that's kind of how I got my feet wet. As a company, we're in every field you can imagine except for nursing homes, and we don't do home health anymore. But we have hospital contracts, we have pediatrics, school contracts, EMGs, outpatient services, orthotics, prosthetics, and like I said, we have some inpatient hospital contracts as well.
Awesome. Thanks so much for the introduction, Patrick. And I already have about four more questions than I had written down after just your introduction, but I will start with one kind of off the cuff. So I'm sure you were not adequately prepared coming out of PT school to lead a private practice. What kind of changes have you seen in therapy programs over the years? If not preparing, maybe not be the right word, but at least exposing, student therapists to what it would be like, what are the expectations, the challenges of, either running, owning, starting a private practice. Like, how has that education changed?
Yeah, I think it's a mixed bag. I think there's some schools that do a really good job of this, and then there's a lot of schools that still are finding their footing in this, particularly some of the newer schools. Um, Business, as a formal part of their education, is usually slighted, much like in the medical field. They may have one or two brief conversations on it or seminars, but it's really kind of on your own. And I think the big thing for me that's the challenge for new therapists thinking about getting into the business world is all the administrative hoops that you have to know and learn and jump through to be a Medicare provider, to be an insurance provider, to be contracted and compliant with all those things, along with the billing and the challenges with billing and collecting. Those are huge, huge time-consuming issues that people do. A lot of times people opt to just say they're going to do cash only. And they may do very well with that. But as we all know and saw during COVID, those that were in cash business had no cash business. So, I think from a school education standpoint, I know I'm privileged to speak to about 4 schools here in the state of Georgia. 2-hour seminar on private practice. People get my number and we'll follow up with questions. But more of what the schools are spending their time on, and Marriott and them can talk about this as well, is more of the government regulations, CMS, what is CMS, what are the codes, what are CPT codes, NPI, all that, kind of the basic stuff to just be able to speak the language.
Perfect. And right, it does seem like that's evolved, but probably not still where it needs to be. But kudos for you for taking time out of your schedule to work with those programs and share your story and share your experience.
It's an
Um,
honor.
as far as the time that you've been in a leadership position, I know you've seen lots of change within our industry, and I know our company has been fortunate to operate both kind of freestanding private practice clinics along with contracting with different organizations over the years. But what's been probably one of the single biggest change you've seen in the private practice setting during your tenure with HPRC?
Oh, wow. I think the one of the big things is difficulty getting in networks. There's a lot of insurance companies that have closed networks and don't allow new people to participate. That's one of the things. Um, I think the games that insurance companies play to keep their money and avoid paying us is another. A lot of them adopt Medicare rules, but then they kind of um, will not even play by the government rules there. So I think the reimbursement has been a huge thing. Um, yeah,
No, perfect. And right, it sounds like the business is continuing to evolve. And I'm sure when you first started, cash-based patients or clients were not part of the landscape. And so that's been something new that we've all had to adapt to over the years.
yeah. When my father-in-law started, Medicare wasn't even around. So for his first 30 years, whatever he charged, he got paid. That was starting to change when I came around in the late 80s, 89, and then managed care hit. And that was when it all evolved.
So if our kind of target audience is students who are transitioning into their first job and they're speaking with different groups, companies, organizations, what are some of the advantages to working in a private practice setting? And then I'll also flip that and ask maybe what some of the disadvantages would be. So that, students have a lot of opportunities right now in our field, and that's great. And we need to try to do everything we can. I know to keep them in our practice settings, but what are some of the kind of advantages that a student would see or some of the disadvantages as you're kind of looking at a first job?
Yeah. So right off the bat, one of the big things is type of patients. So if you're going to a private practice that's owned by an orthopedic group, you're going to see all the post-op people you can imagine. If you're going to a private practice that's not affiliated with an orthopedist, you're going to see a lot of other things, and you're going to have to be really astute at just a wide variety of skills. And when you really think about our profession, uh, you know, I didn't go into the profession to just treat post-op people. I went into the profession to treat all kinds of patients. I'm not smart enough to treat pediatric patients, but the rest of them I have survived and not harmed anybody. Um, but I think that's a big one. And I think the other is when you're looking and interviewing, ask the employers, what are your opportunities? If you really want to get in to the business side of it, what are your opportunities that they have to go in and learn clinically, but also maybe from a business standpoint and opportunities and training in that. But I think the big thing is, to get someplace where you can really learn clinical skills to enhance your own offering to patients to start build your own reputation.
That's perfect. And I know one of big advantages that we've been able to take advantage of are the different pathways that Confluent offers for both kind of a clinical specialty and or more of a managerial or leadership route. And I love the structure around both. And certainly when you were coming out of school in your program, and I know for myself, they just didn't have those type of managerial leadership programs in our field. And I think if students have an interest in that and they have a passion for either private practice or business or leadership, please talk to your employer about what programs they offer. And the amount of structured offerings that we have here is really second to none. And uh, I know personally, I've always thought of leaders and managers as kind of skills that you have or you don't have, but I've been pleasantly surprised that I've been able to learn a lot of skills, and the group here at Confluent does a wonderful job teaching those skills. So
Yeah, and
on a
I would add, one of the attractive things about us and some of the other partners in Confluent is we're in a lot of different fields. So if you start out in outpatient, you decide you're interested in inpatient or pediatrics or sports medicine or whatever, you can move around within the company without having to change employers.
Exactly. We've been fortunate enough to offer different experiences to our students. And, I know I've certainly evolved over my years of practice as far as what I've seen between different patient settings, clinic settings, and then kind of more managerial. So, and and do you feel like that's probably also one of the advantages of a private practice type setting versus maybe working in a hospital system and or maybe a university system that, you know, trying to grow or expand your leadership or managerial skills in those settings may be a little bit more challenging?
100%. I think any reasonable private practice is always looking for diversification. And if you start working for somebody and you kind of develop an interest in whether it's balance or geriatrics or Parkinson's or whatever, chances are they don't have a program, and they would look for somebody to want to head that up. And by heading up a program like that, you really learn a lot of business skills to be able to justify the expense, the training, the time, what the revenue can be, all those things. And a lot of times in hospital systems and larger systems, it's much more structured, and a hospital primarily does therapy because it's a requirement. It's not something they make a lot of money off of. And most of the CFOs of hospitals see therapy as an expense center.
Yeah, all good points. And I think if I'm reading into that answer a little bit too, private practices generally have more flexibility and different revenue streams. And I guess then to flip this a little bit, we've talked about some of the, I don't want to say negatives, some of the challenges that the private practice setting has kind of encountered over the years. Um, but I guess what could you offer to students who kind of have that desire like you did, that want to get into the business management, ownership side of physical therapy? Kind of what words of encouragement or positive could you offer them listening tonight?
Yeah, thanks. I would be remiss if I didn't say that I feel like private practice is one of the ways to really build your income, your personal income, and the ability to expand and grow. Whether it's all depends on how hard you're willing to work and what kind of time you want to put into it. But you become your own boss, and you succeed and fail based on your efforts and your knowledge and your skill set. And anytime you have your own personal business, there's tax advantages that you have over a regular employee. Um, Obviously, you got to work with an accountant and a professional to do that, but there are caveats and things like that that are advantageous. Um, all my friends in the profession have had private practices and do well. They're in their 50s and they've generated a practice that's generating, and they're not having to work 60, 70 hours a week, but they did for the first 30 years. So again, it's kind of whatever your personal goals are and what your desire is. and then whether it's short-term satisfaction or long-term satisfaction. But I think the flexibility and the ability to generate more income is definitely in the private practice world.
Perfect. And I probably have two other questions here that I generated through that conversation. So you mentioned some of your colleagues that you've been fortunate enough to get to know throughout the years in private practice throughout the country, and they've been able to build successful practices. Do you feel that environment still exists for someone today to be able to build a practice to a point or to a maturity level, maybe of some of the brands for Confluent? Is it easier or harder? And then kind of the follow-up question is, what resources have you used over the years, or you taken advantage of, to help you and meet some of these colleagues throughout your career?
So, as far as kind of getting into the field now, definitely, there's different challenges than I faced and my father-in-law faced, and there are some big challenges. Resources and income and financing are big ones, particularly with the student loan debt that's already out there. Um, but there are small business loans out there. There are entities that are willing to bring people on and make them partners. There's, things like that. Bigger companies like us and Confluent, the things that are, I think, attractive to people in practice is we have all the kind of the admin as well as benefits. We have the tools that allow people to grow and hire people and provide those things that some of the bigger employers provide, and still stay private practice and still have control of what you're doing, and really reaping the benefits from your efforts. So I definitely think private practice is one of the things that's, Larry Benz always likes to say, private practice is the one entity in physical therapy that's survived forever, and we feel like it will. It's always evolving and adapting. You'll find that all the new ideas generally occur in the private practice world, and they're finding ways to try to beat the latest challenge from insurance companies and the government. You know, so yeah, I definitely think there's a lot of different opportunities out there in the private practice world. As far as like my mentoring in the private practice section, I'm biased because I've been in the private practice section for, gosh, 25 years. Um, Private practice therapists like to share their information. They like for everybody to succeed. Again, quoting Larry Benz, anytime one of our therapy partners succeeds, it's good for all of us because it's good representation. So you never want to badmouth a competitor. You want them to succeed as well because that just makes physical therapy look good. But there's lots and lots of resources, particularly in the private practice world. And then with big partners like Confluent. That was one of the big reasons we joined Confluent 4 years ago, is we just did not, even though we've been around a long, long time, we just did not have some of the resources we needed to be able to grow and expand. And we've since gotten those and just flourished being with Confluent.
Perfect. And so then to kind of give a not so subtle plug, then it sounds like the private practice section within APTA has been huge in your kind of growth and development and mentorship and your ability to find like colleagues throughout the country and compare notes. And again, that's a benefit that we support, I know, at HPRC for therapists that want to be involved with that. So, well,
Yes,
perfect.
very much so.
And if I'm thinking right, you're headed there later this week. Am I correct?
Correct. Wednesday.
Well,
Yeah.
good. I, I will share a quick story that Randy Weimer, our vice president, had asked Patrick to show around a new partner at private practice because Randy wasn't going to be there. And I warned the new member that walking around the private practice hall with Patrick is like a high school senior football player walking around a recruiting event with Nick Saban. So you get a lot of folks that come up and say hello and want a handshake. So I feel personally very fortunate to have learned from Patrick over the years, and he's been a wonderful leader for our company. So we certainly appreciate all the effort that you put in. And Patrick, thanks for sharing your time and insight tonight. So I'll let you get back to enjoying your father's birthday party, and we can kind of pivot to the second half of